At the time of this recording, it is the start of the fall sports season here in the DC area. Athletes were off for their summer break. They're now easing back into practice. And in our clinic, we're already seeing many of these injuries start to present themselves that are so common as athletes get back into their sport, pick up that volume. And that can be due to just the sudden increase in volume or activity of what they're doing for their sport that maybe they weren't quite as prepared for as they could have been, leading to overuse injuries just because maybe it's a preparedness issue for what the particular injury or area of the body could handle. Now, in other cases, many athletes have been training hard the whole summer. They've been in the weight room, they've been doing the workouts that their team or their coaches maybe have given to them, but they're still experiencing some of these injuries, maybe whether it be a cranky knee or an ankle, maybe their hips bothering them, or they have a soft tissue injury, such as a hamstring strain or a quad or hip flexor strain. Whatever it is, it can be frustrating because the athlete, they put in the work during the summer to hopefully prevent these kind of issues and be ready to really get a leg up on their competition as soon as their practices start. Now, in many of these situations, that can be due to the fact that even though training was occurring during the summer, maybe as we got closer to the season, the athlete wasn't participating in the types of drills or doing the kinds of things that mimicked a lot of what they were going to be doing when they got into the field. Because the idea with any training in the off season is we want to maybe start off a little more general, and as we get closer and closer and closer to the season, it starts to mimic many of the forces and environments and prerequisites that that athlete is going to have to be able to handle for the sport they're going back to itself. So for example, if you are a field sport athlete, let's say you're a football player, it's very reactive in nature. You have to be able to react and change directions quickly in response to an opponent or what might be happening in front of you. And here's a drill that we took one of our athletes through the other day where they're mimicking something like this, but using hurdles. Now, this is an introduction to the drill for this athlete, so they haven't quite mastered it yet, but we can see sort of where this is going and how it might prepare the body to handle those sudden reaction skills that they're going to have to be able to handle when they get back to their sport. So then their soft tissue, such as their tendons and their ligaments and their muscles, are ready for when that gets thrown at them, and then they are less likely to have an injury as a result. Also, our muscles and soft tissues have to be able to slow ourselves down quickly as we decelerate and reaccelerate into a cut or participate in something like sprinting. And this drill here our athlete's going to is actually preparing the hamstring to be able to put on the brakes quickly. Because if you've seen a past video that I recorded, the majority of hamstring strains occur as the hamstring has to rapidly contract to decelerate the advancement of the shin bone, the tibia, from advancing forward, which occurs with a great deal of force as we're sprinting. So these are just two examples of drills we may use to help teach an athlete to be able to quickly slow the body down, reaccelerate, or simply be able to handle the sudden changes of direction or forces that may occur in their sport. Now, right now in our McLean facility, we are offering free injury consultations for any high school athlete that has had an injury as they've returned to play, returned to practice. So if you were out there, you're the parent of an athlete out there who maybe is complaining about some sort of cranky area of the body or has had an injury of some sort, we would encourage you to schedule that consultation with a member of our team at McLean, myself, my colleague Dr. Matt or Dr. Sam, so we can identify exactly what's going on and prescribe specific drills to nip this issue in the bud as quickly as possible so it doesn't take you out of as much practice as maybe it could. So if that's something you're interested in, contact us. We would love to be able to help.